content, yes, for the language of anatomy. And so I'd be happy to address questions that you have about that, and then we'll make the quiz available this afternoon. It'll be due by the next time we meet together, which will be Wednesday of next week. Does anyone have any questions about language of anatomy things? Feel comfortable about where things are? Yes?
On the quiz, I noticed that if you did activities on the online thing and then the one you have on the slide, some of them were different, like for the body regions.
What was different now?
Like the games or activities on the website and then your slides. Like I went to do like the game stuff, like the practice, and some of them were named differently. So I didn't know which ones.
Can you be more specific?
Like on your slide, the shoulder, you put shoulders, what it's called, but on the game, it's called the acromial.
The acromion. Yeah, so both of those are right.
So it doesn't matter which one?
No. It would be good to be familiar with both. It's a good question. And I'm glad to hear you're going through the games stuff online. That's a good learning tool. Any other questions that you have with me yet? No one has any other questions about the anatomy content? Yes, sir.
There was like two different names for elbows. On one slide. I don't remember what they
No, I don't think it would have been called the back of the elbow. Okay, so you had a name here on the anterior aspect, like cubital. Okay, so the anterior cubital fossa or the cubital region here. The posterior aspect is normally referred to as the olecranon, which is the pointy end of the proximal side of the ulna. So olecranon would be the name on the posterior side. That is the olecranon. Yep. Okay, so she's asking about the name, the popliteal fossa. Can y'all help me? Where is that? Yeah, that's on the leg. The popliteal fossa is the posterior aspect at the knee. This is the popliteal fossa here. Other questions that you have for me? Yes?
I noticed just now when you got on that you have something on the side that says links to videos. But the only thing we have says class videos. But there's nothing that says links.
Okay.
We can see your video from Monday.
Huh. Okay. Well, I'm glad you brought that up. When I answered this question, I couldn't figure out why you couldn't see the links, but it's not available to you. Okay, that's a very important matter.
That's not there.
That's not on your
All we
site.
have is class videos.
Oh, yeah, we don't have it.
Y'all have this.
No.
Okay, do you have your phone? Can you check it now? See if that did it. It's still out there? Log off.
She did.
And log-
It's on there. I got my computer right here.
No, that's not the one we're looking for. We're looking for the one that says links. It's still not there? No?
Press the buttons that show the thing.
Okay, that should do it.
Got it?
I did it? Okay, ask one more time about other questions, so that's good. I'm glad that you brought that up. That's important. Any other questions? Did you guys learn about the serous membranes? You did? Sometimes that causes confusion. So what is a serous membrane? Yes, ma'am.
You told me to re-ask this. I was supposed to ask it Wednesday when I asked you Tuesday in the lab. How far do you want us to study live?
How far?
You told me when I asked you in the lab when we were all in there, I asked you how far do you want us to go, like, studying live? And you told me to re-ask it in class.
Okay. You were asking about the
Like,
serous
because
membrane?
you told us to stop at a certain point on Monday, and Tuesday when we were in the lab studying, you came in there.
Yeah.
And I asked you, how far do you want us to go? And you told me to study the whole, all of it. But
Okay,
you told me to
good.
re-ask in class.
Okay, great.
For everybody.
Okay. So I think what I wanted you to ask me was about the serous membranes. Of course, I want you to go through all of the anatomy language, but I need to make sure that all of you are confident in describing what we mean by a serous membrane. Okay, so if you don't give me feedback, I can't help. Okay. Around the heart and lungs. Okay. So tell me this: if I opened up the thoracic cage and I put my hand on the lung, what would I be touching? No.
Visceral.
That would be visceral pleura. Exactly. Yeah. So if I have the thoracic cage open like this, and I put my hand in here and I touch the lung, the organ, visceral layer. If I press the back of my hand against the inside of the thoracic wall, that would be parietal pleura. Okay, what about in the abdomen? If I touch the stomach, what am I touching? Touch the stomach. I open up the abdomen. I'm still talking about serous membranes. I touch the stomach. What am I touching? It's the organ, it's visceral, right? But what's the word? What's the serous membrane word we're looking for here? It's not pleura anymore, is it? What is it? We are now touching the peritoneum. What if I did the heart that way? So I have the thoracic cage open, and I see that the heart sits inside a bag. That's the pericardial sac. What would I have to do in order to touch visceral pericardium? I would have to cut through the parietal pericardium. Exactly. So if somebody's doing heart surgery and they're doing bypass, they're going to have to cut through parietal pericardium in order to get to the surface of the heart, which would be known as visceral pericardium. Now your textbook uses the example that every book uses, and that's the illustration of the fist and the balloon. So if my hand, my fist, is the body organ, it's the lungs, it's the heart, it's the stomach, and the balloon represents the pleura. The balloon represents the serous membrane. And I press my fist into the balloon so that the balloon is now covering my fist. The part of the balloon touching my fist would be called visceral. Then there would be a space filled with air in the balloon. And then the part of the balloon not touching my fist on the outside would be called parietal. Does that help? illustration for serous membranes. Okay, anything else for anatomy language? Big quiz over the weekend. Get you guys prove to me that you know where everything is, where you know where the olecranon and the popliteal fossa is. What about sections? You can handle sections? What kind of section is this? Frontal. There's another word for it. Coronal. Frontal coronal. What is this section? Transverse. What two pieces do I create when I cut the body in a transverse section? And I will not take top and bottom. What? Yes, I hear it. Superior and inferior. Yes. If I make a section that is sagittal, it's not mid-sagittal, it's a sagittal section over here. I now have two pieces of body to look at. This piece would be called the medial piece. This piece would be the lateral piece. If I cut the body in a frontal or a coronal section, I create two pieces. Yes, one piece would be posterior, one piece would be anterior. Are there other anatomy words for those? Dorsal, which means posterior, right? And ventral, which means anterior. Good. Okay, so the questions are going to come out like that, right? I'm going to say things like, in the question, like let me think of a good one that you wouldn't know unless you've been looking at them. The crural region is blank to the femoral region.
Below.
Okay, that's correct. That's not the anatomy word. Yeah? I'm looking for either proximal or distal. Distal. Good. Okay. All right, the next section of anatomy and physiology is the discussion of the tissues. And you've already begun this in the laboratory. So this will be good. We'll be reiterating some things that Dr. Moore is teaching you. We will split the tissues up into 4 groups: epithelial, connective, muscle, and nervous. What I will do with each of these, in this section, I will present to you characteristics of epithelial with examples, characteristics of connective tissue with examples, and then we will spend a very small amount of time on muscle and nerve, because this class, this first half of anatomy and physiology, will cover quite a bit of muscle and nerve. So we don't have to do all of that right now. So the major emphasis will be on these two, with just a few observations about muscle and nerve. Okay, so epithelial first. We say that it has cellularity. What we mean by that is we define epithelial tissues based on the cells that make them. Epithelial tissues are the cells that make them. It doesn't mean that cells don't make muscles and cells don't make connective tissue. That's not what we mean. It means that we define these tissues this way. So if we look at an epithelial tissue, we're going to define it by what the cell looks like. And we put them in categories. Is the cell flat? If it is, we'll say that it is squamous, a word that means flat. If the cell is equally tall as it is wide, we'll call it cuboidal. If it is elongated, taller than it is wide, then we'll call it columnar. Some places, these tissues will be stacked on top of each other. In that case, we'll call them stratified. And some places, there'll be one layer, we'll call that simple. Simple and stratified. Squamous, cuboidal, and columnar. These are our characteristics. We define it. We define the tissues based on the cells. Now, in epithelial tissues, we find that they have specialized contacts that form continuous sheets. All right, so on this second bullet, I want to tell you this. Whatever lines you and covers you is epithelial. So all of this on the outside, this is epithelial. If I go in here, or in any other orifice, it's epithelial lining. So, as we're going through these, I'm going to point some of these out to you so that you will know. You go to various regions in the body, you'll know what kind of epithelium to expect. Epithelial tissues cover and line. They make these continuous sheets. Now, these continuous sheets or linings and coverings of the body do in fact have specialized junctions in places. For example, you can find epithelial tissues where the cells are joined together by what are called tight junctions. All right? So this is my opportunity to introduce to you blood vessel anatomy. So this is a little extra than the way the textbook goes into it, but it will help you. It's things that you can never forget in anatomy and physiology. Stuff that you pick up and you just never forget. It'll come up over and over again. If I have a blood vessel and I cut it, a blood vessel, I will see that it has three layers. The inside layer of the blood vessel is epithelium. It is in fact simple squamous epithelium, and I'm going to say that again on the first picture we look at of the lung. Simple squamous epithelium. So why do you bring that up now? Well, because if that's what the inside of the blood vessel is, then this is going to dictate all over my body how things manage to get out of circulation and into the tissues. So if I'm in the brain, if I'm in the liver, or if I'm in the kidneys, it will make a difference as to how the lining cells are connected. So you can hear it in the language, right? If the cell is connected tightly, will that make it easier or harder to get things out of the blood supply into the tissues? Harder. Yeah. So if the connections are looser, so we have a couple of these others that we'll talk about later, fenestrated connections or discontinuous connections in the liver, things where there are holes or gaps between the squamous epithelial cells. That's going to say something about the function of the organ. You know, in your kidneys, we move, everybody does this, we move about 180 liters, 90 2-liter bottles worth of fluid out of circulation into the kidney tubule network every 24 hours. So later, when I show you that the epithelial lining is different there in the capillaries of the kidney, you're going to go, well, obviously, it has to be that way. Otherwise, you're not going to be able to filter all that liquid. So this will speak to us in physiology, the junctions. Now, the tight junctions, the most famous tight junctions between epithelial cells in the human body is in the brain. Normally, when young people learn brain anatomy, they get a cow brain or a sheep brain to learn anatomy with, or they learn it in some kind of teaching scenario where the teacher shows them a picture of the brain. And as you're working your way down to the brain, you see it's covered. The brain is covered by a connective tissue, 3 layers thick, called the dura mater, or the meninges. We'll do that in the brain later. And then the student imagines, okay, if I say something like, if I say the term the blood-brain barrier, everybody thinks there's some kind of barrier between the blood supply and the brain. And you think, well, this covering must be somehow creating that. That's not the blood-brain barrier. The blood-brain barrier is the way the epithelial cells in the blood vessels are connected. It is very difficult in the blood supply to your brain to get things out of circulation and into the brain tissue. This is called the blood-brain barrier. It has a major impact on clinical settings today. For example, your patient has Parkinson's. You know that the Parkinson's patient has suffered death of neurons in their brainstem in a structure called the substantia nigra, neurons that produce a chemical called dopamine. So I want to help this patient, so I give them dopamine, and it does nothing for them. The reason for that is because dopamine doesn't cross the blood-brain barrier, and there are no transport processes to move dopamine across the tight junctions there. So you can dope them up with dopamine if you want to, but it's not getting in. So you have to give a different kind of molecule, L-DOPA, that will actually cross the blood-brain barrier, or you're going to have no impact whatsoever. Okay, so this has meaning, the junctions, the specialized contacts between epithelial cells. Now the desmosomes will pick those up in the skin, so we'll hold on that. Epithelial tissues are avascular but innervated. The prefix A in anatomy means not. So these tissues do not have blood vessel supply. The epithelial tissues do not have blood vessel supply. Now wait a minute, weren't you just telling us that the blood vessels themselves are lined with epithelium? Yes, I told you that. But if you look at a section of the blood vessel wall and you look inside the epithelial lining, you will not find any additional blood vessels supplying it. So anywhere you go in the body where there are epithelial tissues lining and covering, you won't find blood vessels. The skin, for example, the outer layer of skin, if you look at it under a scope, you will not see any blood supply there. The question then becomes, how do those tissues stay alive? So we're going to have to supply something to these tissues for them to survive. That supply is going to come from the underlying connective tissues. The blood supply will be in the underlying connective tissues. You won't find blood vessels in the epithelium. The second observation here is these guys are in fact innervated. This means they have nervous system supply. So in anatomy and physiology, you need to think in these terms wherever we go. What is the structure? What is its blood supply? What is its nerve supply? This will be a very common way of talking about anatomy. When we're talking about epithelial, no blood supply, does have nerve supply. And these tissues are highly regenerative. The best example of this regenerative capacity that will get your attention, hopefully, is in the digestive system. So I told you that epithelium is lying and covering. So all this is epithelium. All this is epithelium. All this is epithelium. All the tubes inside me, epithelium lining. Okay, so let's just go down through the digestive system. As I move into the mouth, the next piece of the digestive system is the esophagus. And as I move through the esophagus, I go into the stomach. Well, the epithelial linings change. The lining of the esophagus is a stratified squamous lining. You've learned some of this. What do I mean by stratified? Multiple layers. What do I mean by squamous? Flat. Multiple layers of flat cells. These are normally the most highly regenerative tissues in the body. Your skin is stratified squamous, and you replace the entire depth of the epidermis every 30 days. Highly regenerative. Now, you swallow something that goes into your stomach, the stomach lining is simple columnar. I have a picture of that coming up. So there's a major transition from this thick stratified squamous